Tracy Evans. She is, and I have the distinct pleasure of introducing her today. She's a mother of 3 sons, a wife, as well as an autoimmune disease patient, and she's here today to share her personal story, which will illustrate the need for awareness about autoimmune diseases, as well as the access to specialty care. So please help me welcome Tracy.
Good afternoon, everyone.
Good afternoon.
As Steve mentioned, my name is Tracy Evans. I'm a lupus SLE survivor. I was diagnosed just over 3 years ago, but my symptoms have long been there throughout my childhood to the present. In 2001, after a car accident, my previous doctor ordered an MRI, which showed I had had 2 strokes and loss of hearing. Even with that information, my previous doctor told me the strokes were more than likely due to my job, being a machinist, and duties of home. So my previous doctor felt that there was no need for me to see any specialist because I was so young and my body was strong from what she could see with her eyes. As my condition continued to worsen, my doctor told me just to continue the regimen that she had been giving me for the last almost 10 years of just taking Behcet to relieve the pain. Behcet no longer worked. My symptoms worsened and progressed. My machinist job of 10 years, I had to give up. After taking several leaves of absence from my job, I could no longer work a full year without taking off 2 to 3 times a year for medical reasons. And those medical reasons, I was off for months at a time. The symptoms continued, and in 2004, when I walked away from my job, which put our family in a financial strain, I was added to my husband's insurance. That allowed me to be able to see specialists of my choice without a referral. I started doing my own research on my health and found my current doctor, which is very educated in autoimmune disease. She began her own medical library from the beginning to the present with me. She also tried to help me gain access to Social Security disability in 2006, in which I still stand waiting for my 3rd hearing from continuous denial. As of today, my diagnosis and conditions consist of lupus, SLE, and pulmonary, along with fibromyalgia, and several other autoimmune diseases. I've had 5 surgeries, with 1 up and coming, blood transfusion, congestive heart failure, 2 strokes, seizures, tremors, vision problems, diverticulitis, deteriorating mobility, vitiligo, hemiplegic migraines, lung damage, memory loss, and much more. My list continues to grow. When I returned home to Michigan, I would begin immediately my weekly iron transfusions from iron deficiency for the next several weeks. I know if I had access to specialists long ago, I would not stand here today with organ and tissue damage that now threatens my life daily. This is my story. It's the only one of many. do consider helping us improve living life with autoimmune disease. Again, I am Mrs. Tracy Evans from Michigan. I thank you for your time and your attention.